As a nurse practitioner, one of my first patients was a 17-year-old young man who came to me for help because he was using 7 bags of heroin a day. We have effective and life-saving treatment for opioid use disorder. The medications buprenorphine and methadone have been shown to decrease the risk of opioid overdose by more than 50%. Yet many people that need this treatment never are able to access it. My patient needed medication, but he also needed someone who could bring together their skills, their knowledge, their prior experience, and their judgment to create a full plan of care for him. In North America, as nurse practitioners, we have been able to prescribe treatment for opioid use disorder within the past 5 to 7 years. I wanted to understand how nurse practitioners experience the development of their own capability as they learn to do this work. I interviewed nurse practitioners here in Ontario and in the 6 New England states in the United States. I asked them how they got started treating opioid use disorder, what they learned, how they learned it, and how their practice evolved and changed over time. Nurse practitioners experienced an increase in their ability to incorporate flexibility into their practice. They developed patient-centered approaches that allowed them to target treatment to the patient in front of them. They reframed their definition of expertise to include the patient as expert in their own care. Some even had patient advisors whom they would call if they had questions about something new they were seeing or hearing about in the clinic. All of this is important because our published clinical guidelines cannot always keep up with a rapidly changing street drug supply. In the words of one nurse practitioner, doing this work felt like practicing on the verge. In Canada, in 2020, 6,300 people died of opioid-related causes. In the United States, this number was more than 68,000. I hope that my research will help us as nurse practitioners to work together with our healthcare colleagues, with policymakers, with educators, so that we can increase access to treatment for everyone who wants and needs it, and decrease the number of opioid deaths and poisonings. I wish I could tell you my patient was doing well. Unfortunately, he is still struggling with many issues on his journey to recovery. My hope for him is that he never becomes a statistic on someone's PowerPoint slide. Thank you.